Welcome to the Wow MD podcast, where in each episode you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Chernayanu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. Hello, dear listener. Today is February 1st, and I'm recording the podcast on a Sunday, as I usually record my podcast episodes on a Sunday to release on the next Friday. And I had 2 more episodes slotted to go about the benefits of self-care and more things I wanted to talk about regarding the health insurance and premiums, and I kind of left it up in the air. I will come back, but I just realized that it's February. It is technically Feminine Wellness Month. And I know nobody made it that way, but hey, it's Valentine's Day in 2 weeks, and it's time to reconnect with the partner. It's time to dedicate some attention to the feminine health. So I looked at what I did last year for podcast episodes. I talked quite a bit about painful intercourse and what can we do and some laser technologies that we can use to help. And to keep in the theme with sexual intimacy and wellness, what I'd like to do in this episode is talk about Prolapse, which is something I haven't approached before, but I want to talk not what Prolapse is. Everybody kind of know what Prolapse is. Everybody knows. And if you don't, it's very easy to find out online, but I will explain it to you in this episode. But I want to talk about something that it's not really considered. And a lot of women are completely unaware. And this is a devastating specific female condition. And when it happens, women are shocked and upset and frustrated. And there is no real treatment other than surgery or pessary, and I'll talk about, or laser technology. And all of those are annoying and painful, and it requires recovery. And some of them are not painful and they don't require recovery, but they're very expensive. So let's talk about that in this episode. And I'm probably going to continue with next week's episode as well. But today I'm going to focus on the connection between the hormone deficiency that afflicts all women after menopause, the estrogen loss, and the pelvic floor tissue weakness that's leading to prolapse. And again, not many women are aware that there's a vital connection between estrogen and the quality of their tissues, including their pelvic floor. That's because no one is talking about it. And it's probably not something you're going to hear from your regular OBGYN, but you're hearing it today from me on this podcast episode. So first and foremost, what is a prolapse? Well, prolapse is caused by the weakening of the pelvic floor muscles and the tissues that support your feminine organs. So the strength of these tissues, the flexibility of these tissues allows your organs to stay up where they belong. And when that weakens, these organs will fall down or descend towards your vaginal opening. So technically, it's a displacement of your cervix, your uterus, your bladder, your rectum, and sometimes even bowel loops. They all sag with gravity and they come down towards the vaginal opening, obviously, when you're standing or sitting. And in very severe cases, they're actually protruding through the vaginal opening itself like a big bulge. Obviously, this is a very bothersome condition. Like I said, there is no specific medical treatment. You cannot take a pill and make this go away. You cannot rub a cream on it and make it go away. It really requires surgery to correct it, especially when it's that advanced, like what I just described before, like a little bump that comes out and you feel it. And because surgery cannot really restore the quality of your tissues, it might only be temporary. It could give you relief for 5 or 10 years, sometimes less, and it will create some relief. It might not be permanent, and there's always a chance that the prolapse will come back because we're not really addressing the core problem with the surgical correction. And what's causing prolapse? Well, I mean, you've all heard about this. This is not new. Prolapse has always been associated with childbirth and the trauma sustained by the pelvic floor muscles and the connective tissue during the process of labor. The actual dilatation, which takes many hours, sometimes days for young women who are having their first child. And after that, after you've dilated to 10, then it's followed by the effort of pushing the baby's head and body through the, I'm going to say, rather narrow opening of the vaginal entrance to allow the vaginal delivery. So as I alluded in the introduction, what is the connection between a woman's estrogen and her risk of prolapse? Is there such a connection? Well, like I said, many women are not aware, probably every single person who's listening to this podcast, but there is a very strong connection. And the purpose of today's episode is to unravel this connection, to inform you about it, and to explain how estrogen therapy timed right can actually prevent prolapse. And I would like to point out to you the fact that many women who have been able to deliver pretty large children function very well, and normally they have no prolapse all the way into menopause. Early years of menopause, sometimes many years beyond menopause, and then one day, boom, here it comes. Now there's the bump and there's the lump. And what is this? And I've never had this before, and it's very upsetting. And how do I fix it? When the loss of estrogen and the impact of estrogen deficiency on a woman's pelvic tissues and vaginal tissues will reach a critical point at which the elasticity, the tone, the consistency of the connective tissue is severely impaired due to the loss of estrogen. And when the pelvic floor muscle weakening has progressed to the point of possibly no return, then you will really start noticing that lump or bump at the entrance of the vagina, which is what a woman usually feels when she has a prolapse. And you should know that there are two very important critical factors determining whether you do or you do not develop a prolapse. Number one is your estrogen. Even though you haven't heard this before, it is very important. And number two is the strength, the tone, and flexibility of your pelvic floor muscles and connective tissue. And these two things, your hormones and your pelvic floor, are intimately connected. And with this little mini series, what I'd like to do is raise awareness for women of how devastating estrogen deficiency and the weakening of the pelvic floor muscles could be for their ability to avoid prolapse, which is, again, a terribly distressing feminine condition. And let me first focus on how estrogen, your master sex hormone, and as a woman, your primary master hormone for your entire body is not just your major sex hormone. It is one of your major, probably the most important hormone in your body. How does this hormone impact the health of your pelvic floor tissues? Well, the most important factor involved in the stability and strength of your pelvic floor, obviously, are your pelvic floor muscles. These are the muscles that not only surround the opening of your vaginal entrance, but these are the muscles that literally are at the bottom of your trunk and support the totality of your abdominal organs. It is true that the bones of your pelvis are an absolute key anatomical support component, right? They create a bowl-shaped form, which allows all the intestines and the female organs of a woman to rest within it comfortably. But what prevents them from just running out between your legs is that small opening, large enough to allow the passage of a normal-sized baby's head, but small enough to keep everything up there. The ability of your pelvic bowl opening to keep everything in position where it belongs will depend on the strength of your pelvic floor muscles. and will also depend on the strength and flexibility of your ligaments and the connective tissue that's holding everything up, that's connected to the pelvic bones, which are anchored to the bony promontories and other specific locations inside the bowl-shaped pelvis with tendons and so on and so forth. Very few women are aware of how vital these muscles are for their well-being and how absolutely critical the pelvic floor muscles are to prevent or control the degree of pelvic organ prolapse. And I know many women who go to the gym every day, but they rarely do any Kegel exercises. I will talk more about the Kegel exercises when I get to the treatment part. Right now, I'm going to focus on discussing the role of the pelvic floor muscles and how estrogen is connected to this crucial component of your well-being. You might have heard of the link between estrogen and collagen and how optimal amounts of estrogen constantly available throughout the body, not just a few hours a day, are important to maintain your collagen structure. Collagen is an essential molecule giving structure and elasticity to your muscles, including your pelvic floor muscles. Well, you could simply drink more collagen in your water, you might say, right? That doesn't necessarily mean that the collagen you drink is going to make its way all the way down to your pelvic floor. That's another discussion for another time, but I'm mentioning it here because it's important. There are many factors involved in your collagen absorption. The molecular size of the collagen supplement you take, whether or not you also have vitamin C to allow the incorporation of collagen into the tissues. What's the integrity of your digestive lining? Is it able to even absorb the collagen you drink or eat? And last but not least, does the body have the ability to dedicate resources to incorporate that specific collagen into the connective tissue and the muscle support, or incorporated in new muscle formation, which again will be highly dependent on your specific hormonal balance or imbalance. And the truth is simple. Without estrogen, your muscle strength, especially in the pelvic floor area, will decline, will weaken. You are more likely, as you advance in age, to experience involuntary leakage of urine, some stool incontinence, but the very disturbing female organ prolapse through the vagina is the epitome of what every woman would like to avoid. Well, you might say, wow, I never heard of estrogen being important for this. Well, of course not. You have been told for the past 2 decades estrogen is bad for you. So the actual value and role of estrogen was never discussed or outlined for you as I'm doing it in this podcast. Obviously, it would have been a complete contradiction of all the bad stuff they were telling you about the estrogen. But all the stuff I'm telling you now about estrogen, every doctor knows, or at least doctors who understand pelvic organ health know, your OBGYNs know how vital estrogen is for all those tissues. And when they would have told you, hey, wait a minute, you might need some estrogen, but wait, estrogen is not so good for you, you could have asked, how come a hormone so important for me can harm me when I turn 50? That's a difficult question. I bet you they wouldn't have had an answer to that. You could also consider the fact that many women have decided not to use estrogen, even though it's so important for their pelvic floor, sexual, urinary well-being, because they were told it would give them cancer. And I don't know about you, but I would rather suffer from prolapse than cancer. I presume so would anybody else. So that's the real reason behind not having heard of how important estrogen is for your pelvic floor. Because doctors and patients alike were told for 2 decades now that estrogen is bad. Is the tide turning around? Yes. Is the tide turning around like a tsunami the way it should be? Not really. It's just a little bit of a wave going in, going out, nothing like what it should be. And the truth that you should know is that estrogen is super important for your pelvic floor strength, and it's required in order to maintain the flexibility and the tone for all the ligaments and the connective tissue of the pelvic floor, everything that suspends your organs up in its location in the pelvic bowl. And this is exactly why many women, even though they suffered major childbirth trauma to the pelvic floor in their 20s and 30s, they have never experienced urinary incontinence or fecal incontinence or pelvic prolapse until after menopause. They really functioned really well because estrogen was their guardian. When estrogen left and menopause took it away, then the problems start happening. And they don't happen in the first 1 or 2 years. It happens 5 or 10 years down the road. And in spite of what you might have heard, in spite of what you might have been told, and if you're one of my patients listening to this, you know the truth. Estrogen is your best friend. And that is the simple truth. Estrogen is your best friend when it comes to your feminine health. An optimal level of estrogen in your body will ensure a strong and easy to maintain pelvic floor. And that is one of the 2 main reasons why women develop pelvic prolapse after menopause as they age: the loss of estrogen. Because the first and most important factor that happens during perimenopause is the decline in your estrogen to the point of complete disappearance after menopause. Once you get exposed to estrogen loss, your tissues start to suffer irreversible changes because estrogen is important to maintain your muscle tone all throughout the body and the pelvic floor as well. And estrogen has a very important role for the blood circulation. You might have not heard this before, but interestingly enough, estrogen can enhance blood circulation, which is very important to allow oxygen and nutrients to your tissues. In our case, your pelvic tissues. Normal blood flow can help sustain the vitality of your muscles, the pelvic floor muscles, and it will allow connective tissue repair. An optimal estrogen level can optimize the health of both your muscles and the connective tissue, which supports your pelvic organs. That is why many women are able to function normally and do not show any signs or symptoms of prolapse a long time after their childbirth trauma, as long as they have optimal levels of estrogen. Healthy tissues, muscles, ligaments, tendons, fascia, etc., are able to adapt to the extremely variable stressors imposed upon them with day-to-day activities, as long as they have estrogen. Think about how many times you have lifted something heavy. When you did that, your pelvic floor muscles engaged automatically to keep everything in. Think about how many times you coughed, you sneezed, or you laughed hard. All of these activities, the lifting, the coughing, the sneezing, the laughing, pushing something away like a heavy piece of furniture, are increasing the pressure inside your pelvic bowl by contracting your abdominal muscles. This increased pressure will in its turn put a significant amount of stress on all your pelvic floor tissues, your muscles and soft tissues, and these repeated stressors with time will lead to a problem. Luckily for you, as long as you have estrogen on board, you will be able to recover, repair, and restore the day-to-day damage that happens to your pelvic floor much better. And even if you get to the point of no return, now you have a pelvic prolapse, the only option open to you is surgery. If you require surgery, you require some kind of laser to correct a severe prolapse that happens after childbirth, you are able to do so much better if you have estrogen on board. I'll talk more about the technology and surgery and laser and everything in the next episode. Obviously, everyone is aware of the significant changes that happen to the vaginal walls and the vaginal skin surrounding your vaginal opening caused by the loss of estrogen after menopause. It's called GSM, the genitourinary syndrome of menopause. It's also called and known vaginal atrophy. What you don't know is that it doesn't happen right away. It's not like you turned off the faucet and the water stopped flowing. Unfortunately, menopause does that to your ovaries. It just turns off your estrogen and there's no more estrogen. Everything will become dry, not necessarily in a matter of weeks, even months. It will take years, sometimes decades of no estrogen to lead to significant changes of the vaginal environment. And that's different from woman to woman. Just as a reminder, vaginal atrophy is thinning of the vaginal walls with a significant loss of elasticity, accompanied by the hallmark symptom of vaginal atrophy, which is severe vaginal dryness. Now, consider all of this, the dryness, the loss of elasticity, the thinning of the walls. It will create significant discomfort, and it will make women much more likely to avoid any kind of exercise that will involve their pelvic floor muscles, because contracting things down there will not feel good. Obviously, this includes sexual intimacy. The loss of estrogen will cause dryness, irritation, with decreased elasticity, impacting the woman's willingness to perform not just intimacy with her partner, but her willingness to perform pelvic strengthening exercises. And your muscles will continue to weaken as you age. I'll talk more about that in the next episode. But this will also be a major impediment to you even trying to work on correcting it, because the discomfort that's happening down there. Now, here's another thing that you should know, because in the next episode, I might talk more about the various technologies that exist to correct prolapse. We don't have that many lasers that can help it, but I'll talk to you about a few that are available. But this amazing technology, like laser technology, which can be helpful to correct to some extent, at least improve the excessive laxity and all that excess tissue that forms in the course of the prolapse development, has limitations. Because, unfortunately, delivering laser energy to the vaginal walls is only possible if the vaginal walls are moisturized from within. What does this mean? Well, in layman terms, lasers have different targets. Pigment, water. In our case, for vaginal lasers, the target is water. The laser will deliver the energy, which impacts the water within the tissues, and it will be heated by the laser. That heat will be absorbed by the water. The collagen and the elastin within the target tissue will now remodel, will shrink, will tighten, and will improve the pelvic organ descent. Obviously, these are intravaginal laser procedures, right? Now, for someone whose tissues are already significantly dry, it will be impossible to deliver laser energy, because at that point, the risk of burn is significant. We can just put some lubricant on it and then do the laser. We just heat the lubricant. It will burn the vagina. We can't put the estrogen cream on it and apply the laser. Again, it will burn because the energy will be absorbed by the estrogen cream. So at the time of the laser, the inside of the vaginal walls has to be dry, but the walls themselves have to be moisturized by the presence of estrogen. So if anyone is considering any kind of laser therapy, they will first have to be treated with estrogen for at least 2 or 3 months to allow the vaginal walls to become nourished, revascularized, so there's enough moisture within the walls to absorb the energy by the laser so the laser can do its job. So here's the question that everybody probably wants to know. Can hormone replacement therapy reverse prolapse? That is very unlikely. Once the prolapse is formed, it's a hernia. You cannot put a cream on a hernia and expect it to get better. However, the estrogen therapy can improve the quality of the tissues, the vascular supply, which will be able to deliver oxygen, nutrients, and allow the tissues to respond better to whatever other therapies the patient decides she'd like to follow through with, that she or her doctor decide will be appropriate to improve or correct the prolapse. It could be surgery, it could be a pessary, it could be pelvic floor therapy exercises to strengthen the pelvic walls, it could be laser, etc. I will continue talking about pelvic prolapse and treatment technologies available to address it in the next week's episode. I will also review pelvic floor therapy exercises and why doing Kegels is far from being guaranteed to improve anything and why. I will also discuss the challenges of using a pessary as a woman gets further and further away from menopause, and some basic surgery information that everyone should know. So that might take me 1 or 2 episodes to do that. But the key information that you should take from today's episode is that estrogen therapy applied early, and again, here goes the whole concept of timing the estrogen therapy right, can prevent the worst, which is a severe pelvic organ prolapse. Consider partnering with an OBGYN that's familiar with prolapse evaluation. Have an annual OBGYN checkup. I will talk more about this in the next episode. And make sure that you ask, am I at risk for prolapse? I've had this many babies. They're this big. What's my risk? And I know that when you come to the doctor's office, you want to do everything all in one appointment and get the maximum value that you can out of your wellness checkup. Unfortunately, this discussion will not belong in a wellness checkup because there's not enough time allocated to that visit due to the insurance reimbursement restrictions for the doctor to have meaningful time to talk to you about that. So if you want an in-depth analysis of your pelvic floor strength, that can be done. And if you want a consultation where you will be assessed as to what the risk is, that exam takes a few minutes. And there will be some maneuvers that will have to be done. Maybe I'll talk to you more about this next week. But keep in mind that having awareness of the fact that prolapse is real and it could happen to anyone who delivered vaginally, and having periodic evaluations, and once entered into menopause, considering hormone therapy to help nourish the tissues and prevent them from deteriorating further, increasing your risk of prolapse, would be something to seriously consider. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas, so please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.